A record number of American children under the age of 5 are now hospitalized with COVID-19.
Here to answer your questions is Dr. Vandana Madhavan, Clinical Director of Pediatric Infectious Disease at Mass General Hospital for Children. Some pediatricians say the Omicron variant may be more dangerous for babies and toddlers. What are you seeing with your patients, doctor?
We're not necessarily seeing more severity, but we are seeing volume. And we have to think about this as a numbers game. Children obviously are a larger percentage of the unvaccinated component right now. We know that Omicron is so much more transmissible, so there are just going to be more people of all ages getting sick, and therefore more children getting sick. And of course, this surge is coming in the winter, where we have all of these other respiratory viruses circulating as well. And unlike last winter, when we really didn't see influenza at all, we're seeing influenza circulating as well. So we really have this perfect storm of this very transmissible, easily spread Omicron variant, plus all of these other viruses. And we're seeing kids who test for multiple viruses at the same time. And it's really hard to say what their primary illness is coming from. But, we're seeing all the typical manifestations of respiratory infections, whether it's just a little cold that's in the upper airway, with congestion, et cetera. We're seeing croup where the airway is inflamed and they have that barky cough. And we're seeing lower tract infections where their smaller airways lower in the lungs are inflamed and cause something called bronchiolitis.
It's so difficult for parents trying to take care of a sick kid. So what is your advice for parents right now? Should they limit their child's contact with other adults or even other kids?
So, the advice right now is similar to what we give to parents of the youngest children in any, respiratory viral season. It's to really be mindful of exposures. Of course, making sure that everyone who's around a child is vaccinated is so important. We recommend that for influenza, recommend that for pertussis or whooping cough. And now we do that for COVID, that everyone who's around a child should be vaccinated, and really asking those questions when you do have to have your, child around someone who's vaccinated. Let's be safe, and thinking about where you're meeting with others. But yes, this is not the time to add on extra gatherings where, that contact might not be as necessary. Really being mindful of what's important socially for your family at this time.
A real important reminder. Let's get to some of the questions from our viewers. This one is from Maddie. I have 4 children under the age of 7. I'm worried if one gets COVID, will they all get COVID? Are there supplies and meds I can stock now in case they get sick?
Great question. And yes, with Omicron being so transmissible, I think it's definitely reasonable to assume that it will spread within a household, even if not everyone has symptoms. Remembering that Omicron does tend to be milder overall than other previously seen variants. And so even if everyone tests positive, there might be a spectrum. Some people might have cold-like symptoms. Some people might have, more of a cough, and especially the younger children, might not have symptoms at all. But I think in terms of, things to stock in advance, it's important to make sure that, children are hydrated, their fevers are well controlled. So having that acetaminophen, ibuprofen, on hand, their favorite, fluids, younger children, if you know that they prefer Pedialyte or, another similar electrolyte fluid, having that on hand, and making sure there's plenty of hand sanitizer, of course, making sure there are plenty of masks, remembering that cloth masks aren't going to be as helpful right now. So having surgical masks, KN95s, if you do have to take children to the doctor's office, to be evaluated, making sure that everyone has masks on board as well. Remembering that in terms of, other home therapies, there's nothing, that's currently recommended, for the youngest kids. And even intravenous therapies that we have that require, outpatient, hospital administration, those are really reserved for children at the highest risk for developing complications. And so a child with no other medical complications wouldn't qualify for that. So it's really those supportive care measures to have at home.
Thank you so much, Dr. Madhavan, Clinical Director of Pediatric Infectious Disease at Mass General Hospital for Children. Thank you for joining us this morning.
Thank you so much for having me.